L-theanine is an amino acid and it's commonly found in green tea. Together with caffeine, it can produce a distinct cognitive enhancement profile without the jitters or the other side effects. In addition, the L-theanine has many other potential health benefits. L-theanine is an amino acid and it's mostly found in tea leaves and fungi, and it's used to help to improve mood and lower stress and to protect the brain and the heart. Theanine usually refers to L-theanine, which has more potential health benefits compared to D-theanine. Natural sources of L-theanine are tea, especially green tea, and the bay bolt mushroom. L-theanine is able to cross the blood-brain barrier and affect the brain directly. In the brain, it may target brain chemicals that regulate arousal, anxiety, pleasure, and attention. L-theanine increases brain serotonin and dopamine levels, and this can improve memory and learning. It also increases the levels and the effectiveness of GABA, the body's main inhibitory neurotransmitter, and it stimulates alpha brainwave activity, which may cause mental relaxation, concentration, and deep REM sleep. The L-theanine may also increase glutathione levels, the body's most important antioxidant molecule. Given its similarity with the neurotransmitter glutamate, the L-theanine may exert its neuroprotective effects by interfering with its function. There are several L-theanine supplements commercially available, especially to curb anxiety, improve cognitive function, and to boost immunity. In a clinical trial on 30 healthy people, L-theanine improved verbal fluency and executive function. In 18 healthy people prone to anxiety, the L-theanine improved attention. In a clinical trial on 46 people with minor brain damage, a combination of L-theanine and green tea improved memory during a mental exercise. The combination improved recognition, memory, attention span, and alertness during a memory test. The L-theanine also improved recognition memory in rats, possibly by promoting brain development. A breakfast bar with L-theanine, caffeine, L-tyrosine, and alpha-linoleic acid, vitamins and minerals improved alertness, attention, working and episodic memory, and executive function in a clinical trial on 95 people. L-theanine protected the brain against age-related cognitive decline in 29 elderly people and against brain damage due to aging, stress, and Alzheimer's disease in animal studies. L-theanine and caffeine are typically found together in tea. L-theanine often enhances the cognitive improvement effects of caffeine while reducing its negative effects, such as the increased blood pressure. In 5 trials on 124 healthy people, this combination improved the sustained and targeted specific attention, attention switching, reaction time, numeric working memory, and alertness better than either substance alone. This combination also reduced the damage caused by restored blood flow after a stroke, or ischemia reperfusion injury in rats. Taken together, there is some limited evidence to suggest that the L-theanine can improve brain function, especially attention and memory. High cortisol caused by intense exercise shifts the T1-T2 balance towards T2. This increases white blood cells, or neutrophils, while decreasing immune cells, or lymphocytes. This leads to inflammation and immunosuppression. The L-theanine, both alone or combined with L-cysteine, reverted these effects in 4 clinical trials on 66 athletes who were exposed to strenuous exercise. L-theanine, both alone and combined with the L-cysteine, strengthened the immune system and reduced the incidence of the flu and the common cold in 3 clinical trials on 376 people. In another trial on 55 people, the combination improved the efficacy of the flu vaccine. Similarly, the combination increased antibiotic production and prevented the flu in mice. L-theanine boosted the activity of immune T cells, which protect against infections and cancer. In cell-based studies, it also maintained the correct Th1-Th2 balance towards Th1, which enhances resistance to infectious microbes in rats. In 3 clinical trials on 56 healthy people who were challenged with stressful situations, L-theanine reduced anxiety symptoms along with heart rate and blood pressure. Similarly, both a theanine-based nutrient drink and a low-caffeine green tea drink reduced stress response and salivary stress markers of cortisol and alpha amylase levels in 2 trials on 54 people. However, a study on 16 healthy people found that the L-theanine was only relaxing under resting conditions, but not during the acute stress episode. In line with this amino acid did not improve anxiety symptoms in 46 people with a diagnosis of generalized anxiety disorder. Chronic L-theanine as an add-on to their current medication reduced anxiety, sleep disorders, and cognitive impairment in a trial on 20 people with major depressive disorder. In 2 clinical trials on 100 patients with schizophrenia, adding L-theanine to their antipsychotic medication reduced anxiety and overall symptoms. And in rats, L-theanine reduced anxiety. It suppressed the stimulatory effects of caffeine, and it enhanced the anti-anxiety effects of the sedative midazolam. Green tea with a high L-theanine content and a reduced caffeine content improved sleep quality, and it reduced stress in 3 clinical trials on 50 middle-aged and 10 elderly patients. L-theanine can also help with sleep disturbance that's caused by mental health conditions. It improved sleep percentage and efficacy in 2 clinical trials on almost 100 boys with ADHD, 20 people with major depressive disorder, and 17 people with schizophrenia. In mice, a mixture of L-theanine and the neurotransmitter GABA increased sleep duration and quality. In rats, L-theanine partly counteracted the sleep disturbance that was induced by caffeine. As an add-on to conventional medication for schizophrenia, L-theanine improved positive-negative activation and anxiety symptoms of this condition in 3 clinical trials on almost 100 people. L-theanine prevented blood pressure increasing caused by stress or caffeine intake in 2 clinical trials on 64 healthy people. L-theanine decreased blood pressure in hypertensive rats, and it lowered blood fat levels in obese mice. L-theanine may lower blood pressure by increasing nitric oxide production, as seen in cell-based studies, because it also prevented LDL oxidation, and it may help to prevent arterial narrowing. In a clinical trial on 20 people with major depressive disorder, L-theanine as an add-on to conventional medication helped with depressive symptoms, anxiety, sleep disturbances, and cognitive impairments. L-theanine also helped to reduce depression that was caused by chronic stress and strokes in mice and rats. The oral administration of L-theanine together with L-cysteine reduced the adverse effects of adjuvant chemotherapy in a clinical trial on 70 people with cancer of the stomach and the bowel, or gastrointestinal cancer. The L-theanine also enhanced the anti-tumor effect of chemotherapeutic medication while protecting healthy tissues from these drugs in animal and cell-based studies. The L-theanine in tea has dose-dependent antioxidant effects. In multiple animal and cell-based studies, L-theanine protected the following organs from oxidative damage: the brain, the liver, the kidney, the small bowel, and the heart. In mice, L-theanine, along with other components of green tea, reduced triglycerides and fatty acid levels in the blood, as well as food intake and body weight. In a study in rats, L-theanine reduced the uptake of sugars and fats in the gut. L-theanine healed stomach ulcers that were caused by anti-inflammatory drugs in mice at a dose of 10 mg per kg body weight. It reduced oxidative damage and it balanced the immune response. However, L-theanine aggravated ulcers at a 4 times higher dose. For an average weight adult, L-theanine is usually available in pills of 50 to 200 mg. Some people take 600 to 1000 mg per day though. For children, a smaller dose, such as 25 to 50 mg, depending on their weight, is normally recommended. L-theanine is generally well tolerated in clinical trials, and very few people have experienced mild adverse effects like a headache, digestive issue, or a sleep disturbance. Additionally, the frequency of these effects was similar in the treatment and the placebo group. L-theanine, however, can lower blood pressure, so if you're taking blood pressure medicine, you should monitor your levels and adjust your dose accordingly. Due to the lack of safety data in certain conditions, breastfeeding and pregnant women should avoid L-theanine. For more information about herbs, supplements, or natural treatment plans, check out my website.